I do my research mainly because I believe strongly that people deserve an equal right to healthcare, and especially as people are in different sort of social situations and experience different challenges, that the healthcare system needs to find ways to meet them where they're at and make sure that they have access to healthcare that will enable them to live the fullest life they can. My name is Amanda Emerson. I'm a faculty member in the School of Nursing at the University of Kansas Medical Center. Most of the work that I've done is with people after they've left incarceration. So they're back in the community. A lot of our work was with younger women who had cervical cancer or a cervical cancer risk. So women who are incarcerated have a 4 to 5 times higher rate of cervical cancer. And we were really interested in making sure that we could sort of give them the information and empowerment and understanding. Building cervical health literacy was what we called it, so that they would get Pap tests up to date and also go back for follow-up if that was necessary. And what we know about that group is that they are much more likely to experience some of the aging-related changes earlier than other women, so in their 50s as opposed to in their 60s or 70s. And that includes things like frailty, multimorbidity, early mortality. And so what I'm really working on now is addressing that group. They're very easily overlooked. So finding ways to help them get access to programs and the help that they need. A lot of women who do get entangled in the criminal legal system have a history of violent abuse. They have a history of foster care, history of drug use in order to cope with the trauma from those other kinds of experiences. A lot of homelessness. Incarceration doesn't help. Incarceration is in and of itself unhealthy. There's just the psychosocial stress of being imprisoned. The kinds of things that are happening to women early on in their lives are affecting what happens, midway, and affecting what happens as they age. And all of those things have human harms. They have human harms to the women themselves, to their families, to the wider community. They're expensive at every point for everyone. And so making decisions about what's accessible to women when they need to move forward with their lives and they need help doing that, considering that a way to help everyone, I think would be helpful in making that argument in terms of policy. When I was in high school, my mom went back to school and got a BA in in psychology. And then when I was in college, she went to nursing school. And so she was a huge proponent of nurses. So I'm a second career nurse. And when I left my first career, that's where I headed because I could see the passion and pride she had in nursing. I have worked quite a bit with students in the past. I've had Ph.D. students that I supervised their dissertations. A lot of those were based around trauma. I also have worked with undergraduate students in the past as a mentor. I have felt genuinely well supported here, like encouraged to sort of explore and push into new areas. I've felt like some of the support I've gotten from the folks at the Landon Center has been super valuable to me, and Frontiers as well. And all of that's just icing on the cake that is the School of Nursing.